to all the Innovate friends. World Cancer Day is an international day marked on 4th February to raise awareness of cancer and encourage its prevention, detection, and treatment. This World Cancer Day is one singular initiative under which the entire world can unite together in the fight against the global cancer. Today, on the occasion of World Cancer Day, I, Anju Dhingra, President Patliputra Anjuna, along with 6 other club presidents, Nishi Singh, Innoville Club of Dhanbad, Manju Prakash, Innoville Club of Bihar Sharif, Urvashi Verma, Innoville Club of Jamshedpur West, Anshu Shandalia, Innoville Club of Rajgir, Sujata Lohani, Innoville Club of Hazaribagh, and Nita Narayan, Innoville Club of Sanrekha Ranchi, jointly organized a webinar for the interactive session on cancer awareness. And for this, we have invited Dr. Kavita Priya, who is MD and consultant gynecologist from Rajpriya Clinic, and also retired Deputy CMO, Central Hospital, Dhanbad. And second, we have invited past district chairman, Mrs. Kavita Prasad, who is assigned as a director of cancer by our district chairman, Mrs. Poonam Thakur, for the year 21-22 as the chief guest of our today's program on the occasion of World Cancer Day. Ma'am, you both are welcome here. As we all know that prayer is an act of communication with God. So before starting the interactive session on cancer and keeping in mind the protocol of Innerville, I would like to call Mrs. Anshu Shandalia, President IWC Rajgir, for Innerville prayer. Over to Anshu. आवाज नहीं आ रही।
आवाज नहीं आ रही है।
अंशु अनम्यूट करिए।
हाँ। आप सभी को मेरा प्यार भरा नमस्कार। मैं IWC राजगीर आज के इस कार्यक्रम में आप सभी का स्वागत करते हुए इनरविल प्रार्थना करने जा रहे हैं। आप सभी से आग्रह है कि आप अपना दाहिना हाथ ऊपर करें। मित्र भाव के सत्य अर्थ से हम सब में हे ईश्वर भर दो, हम सब ही हैं तेरे बालक, भूले ना
इतना कर दो, धर्म और संस्कृति भेदों का मन में नहीं स्थान रहे, सभी मानवों की सेवा का हमें सदा ही ध्यान रहे, आवश्यकता हमें मदद की हो सकती यह याद रहे, सेवा करने की जरूरतें जहाँ कहीं भी यान पड़े, सेवा करने को सब जन की तत्पर हम सब डटे रहें, इनरव्हील की शान बढ़ाएं, यौवन हमें प्रदान करें, मानव जीवन व्यर्थ न जाए, प्रभु यह कृपा प्रदान करें।
ओम शांति।
Thank you, Anshu. And now is the time for the official welcome address of the delegates, and for this I would like to call Nishi Singh, President IWC Dhanbad. Over to Nishi.
Thank you, Anju. आवाज जा रही है? आवाज जा रही है?
हाँ, आ रही है।
अच्छा, सभी को मेरा नमस्कार। वो कहते हैं ना, सरिता जी तो आई नहीं, लेकिन उनके लिए कुछ चंद लाइन बोलना चाहते हैं, उनका स्वागत करना चाहते हैं। वो कहते हैं ना, कोयल सी तेरी बोली, सूरत है कितनी भोली। आप लोग सभी समझ ही गए होंगे कि किनके तरफ इशारा है। उनकी एक मुस्कान ही काफी उनके एक मुस्कान से ही सारा मन तरबतर हो जाता है। हमारी कैंसर केयर एंड वॉल पेंटिंग वर्टिकल की डायरेक्टर सरिता दी का तहे दिल से स्वागत करती हूँ और नमस्कार करती हूँ कि उन्होंने अपना कीमती समय निकाला। डिस्ट्रिक्ट के जितने भी इसी मेंबर्स हैं, सभी लोगों का दिल से स्वागत है। डिस्ट्रिक्ट 325 के जितने भी पीडीसी उपस्थित हैं, सबों का तहे दिल से स्वागत है और नमस्कार है। हमारी सीजीआर निभा मिश्रा जी का भी दिल से स्वागत है। ये भी कम नहीं है, इतना भी इनके पास टाइम नहीं हो, लेकिन कभी ना नहीं बोलती हैं, ना बोलना नहीं सीखी हैं। ये इनके लिए काफी अच्छा और हम लोग के लिए भी अच्छा, हम लोग भी कुछ सीखते हैं इन सब बातों से। थैंक यू निभा जी, और आपका स्वागत है कि आप इतने अच्छे से हम लोग का प्रोग्राम करा देती है। इसके लिए यही आपको काफी आगे ले जाएगा। आपको हम डिस्ट्रिक्ट चेयरमैन के रूप में देखना चाहते हैं।
आगे बढ़िए आप।
हमारी डॉक्टर जो है कविता प्रिया, ये हमारी मतलब सीनियर मेंबर्स, डॉक्टर लीना प्रिया की बहू है। लीना प्रिया हमारी इनर व्हील की मेंबर्स थी, वो अब नहीं है, और उनकी बहू है ये। और एक बहू सीमा प्रिया है जो हमारे क्लब की मेंबर्स है, ये मेंबर्स नहीं है लेकिन उनकी बहू है। और इनकी एक बड़ी जेठानी है, वो मेरी मेंबर्स भी है धनबाद क्लब की, सीमा प्रिया, अभी एग्जीक्यूटिव कमेटी में है वो। तो इनका हमारी डॉक्टर कविता प्रिया दी का दिल की गहराइयों से स्वागत, जिन्होंने अपना बहुमूल्य समय हमारे इनर व्हील के लिए निकाला। अब मैं इनर व्हील क्लब बिहार शरीफ, अंजुना पटना की प्रेसिडेंट, अंजू ढिंगरा हजारीबाग की प्रेसिडेंट, सुजाता लोहानी जमशेदपुर की प्रेसिडेंट, उर्वशी वर्मा स्वर्ण रेखा रांची की प्रेसिडेंट, नीता नारायण राजगीर की प्रेसिडेंट, अंशु सांडिल्य हमारे साथ वर्चुअल प्रोग्राम के लिए हमारा आमंत्रण स्वीकार किया, उसके लिए इन्हें दिल से स्वागत है। अब उनका बारी है, जिन्होंने श्री रोज गोल को साकार बनाकर पिंक फर्स्ट कहलाने वाली स्ट्रॉन्ग नारी शक्ति बनकर डिस्ट्रिक्ट 325 को स्ट्रॉन्गर बनाने वाली सभी प्रेसिडेंट, जिसने हमारा निमंत्रण स्वीकार किया है, उनका तहे दिल से स्वागत है। और मेरे कहने सुनने में जो भी गलती हुई उसके लिए मैं क्षमा प्रार्थी हूँ, और सभी लोग का दिल से स्वागत है जो भी है आज इस प्रोग्राम में आए हैं। थैंक यू। और निभा जी, आप प्रोग्राम आगे बढ़ाया जाए।
Doctors are the boon directly sent from God to us. As a doctor, people will trust you, confide in you, and appreciate your effort. When there are tears, you are shoulder. When there is pain, you are medicine. And when there is a tragedy, you are a hope. So, for the introduction of our keynote speaker, Dr. Kavita Priya, I request Urvashi Verma, President IWC, Jamshedpur West, to say a few words. Over to Urvashi.
Thank you, Anju. Good afternoon, everyone. It is my privilege and honor to introduce today's guest speaker, Dr. Kavita Priya. She is a consultant gynecologist at Raj Priya Clinic and retired Deputy CMO of Central Hospital, Dhanbad. Dr. Kavita Priya is immediate past President DSOG, Dhanbad. She is organizing secretary of 4th annual conference of AOGSBJ and 3rd annual conference of DSOG. She is organizing chairperson of 4th annual conference DSOG. She was guest speaker in AGSBBJ conferences at Darbhanga and Bokaro. She has worked as medical practitioner, and along with her busy schedule, she has also worked in administrative capacity at different levels. She has been involved in social work also. I welcome her on this forum on behalf of all of us present and request her to address the audience. Thank you, ma'am.
Excuse me.
Thank you. Thank you. Am I audible to you?
Yeah.
Yes, ma'am.
Thank you so much for your kind words, Mrs. Anju. And may I express how honored I am and what a big privilege I find it to be able to speak to you on this very special day, because cancer awareness is a very, very important thing, and that a society like Inner Wheel is promoting cancer awareness speaks very well for our society, and it gives hope to the people all around that we can do something to decrease the burden of cancer in our country. So having said that, may I start sharing my screen? May I start sharing my screen?
Yeah.
Yes, doctor. Just go to
Take
that
a
green,
minute.
yeah,
I'm
green
going to the
icon.
screen. I have that on.
Just click that green icon, share screen. आपके नीचे बार में होगा, bottom.
I'll just check my PowerPoint first, and then I'll do that. It's open. It's a Wednesday. 1 minute. Okay, I'm getting a page which says build forward with confidence or something, which is another page. How will I remove this? It's post attendee Zoom. Can I close this one?
Yes, yes.
But then the Zoom has gone off. 1 minute. This is a bit.
You only open that slide and close all the windows.
I've opened the slide and I'm doing this.
It's coming.
Is it coming? I can't see it.
No, but your Zoom page is coming.
Okay.
So you close this page. You close this page. Nothing will happen. You close this page. Just go in the top. There is a cross icon. Just click that cross icon. Launch meeting Zoom. जो ऊपर में जो आ रहा है ना.
I'll do that. Launch meeting. I'll click that.
No. Don't go for that. In the top. Launch meeting Zoom.
Yes.
उसके बगल में जो cross है, just cross that.
Okay, but okay, 1 moment.
Yeah.
I did that.
Yeah.
So has my screen.
Now your WhatsApp is coming. I'm just stop. Now I've stopped the share screen option. You close your. You want to open your WhatsApp also? Parallelly.
Yes, I don't want to open it. I just want to open this.
Close the WhatsApp also. Close the WhatsApp also.
If I close the WhatsApp, Zoom will go away, no?
Okay, then you click, when you are sharing the screen, you click on the PPT window.
Okay, let me try this once more. It's come now, I think. Is it coming now? No.
Till now it's blank.
Okay, it was coming just now.
Again, it's your desktop is coming. Yeah, it's coming now.
It's not showing to me.
No, again you have gone to WhatsApp page.
Is it coming now?
Yeah, yes, now it's coming.
Huh?
Nah, yes.
Is it okay now?
Yeah, you can opt for the full
start
screen.
Now.
You make it full screen.
Okay.
नीचे में, एकदम नीचे में.
No. It is full screen. This is.
Okay, you go with this.
This is, I think, good enough. It's a big enough screen, is it?
Yes.
Okay, then I'll begin this then. So today, on the 4th of February, this is World Cancer Awareness Day. And this presentation is first about generally in cancers in general, and then about a few specific cancers common in females. Now, the theme for 2019 to 2022, for 3 years, the theme was I Am and I Will for World Cancer Day. And this 2019 to 2022 campaign theme, it seeks to highlight some things, that we have a negative attitude to cancer, and we have this belief that nothing can be done about cancer. So this is something that we have to fight. And instead, we must become aware that our own personal actions can have a powerful and powerful impact upon the cancer situation and the cancers that people have. So this is there here. The same thing is highlighted a little in pictorial form. And this slide is highlighting that we have to stop being negative, because negativity itself worsens the cancer situation. And we have to think that cancer is only going to be a chapter in our life. It's not the whole story. It's not the end of everything. So whoever you are, whatever actions you do, whether they are big or they're small, they will make a lasting positive change, because progress is always possible. I am and I will. Now, the campaign slogan for 2022 to 2024 is Close the Care Gap. 2022 has its own particular set of requirements, and then 2023 and 24 will build on these. And this campaign slogan is highlighting the way there is a gap in the availability of resources. Not everybody has access to proper cancer facilities, and are not able to get proper treatment because of this. So the new World Cancer Day 2022 to 2024 campaign theme is Close the Care Gap. This is about identifying and addressing the barriers that exist for many people around the world in accessing the care they need, as these barriers potentially reduce a person's chance of surviving cancer. The main thing that we highlight in 2022 is everybody deserves access to cancer care. So improve access to quality cancer care for everyone. Now, 2022 says that first of all, we have to realize the problem. That's the very first step in this campaign. So the first year of the Close the Care Gap campaign is all about understanding and recognizing the inequities in cancer care around the globe. So the main points, we have to realize that this inequality in cancer care, it costs lives. The people who look for cancer care, everywhere they meet with obstruction. And the reason for this is the disparity in income, education, location, ethnicity, gender. There's a gender bias, there's an age bias, there's disability, lifestyle. All these can negatively affect cancer care. This gap affects everyone, including you and your loved ones. And we have to understand that these barriers are not set in stone. They can be changed. So I'll just mention to what the next 2 years are going to highlight. This year, we are going to realize the problem of the care gap in cancer care. 2023 is going to be about uniting our voices and taking action. And then 2024 is going to be how together we challenge those in power and force them to bridge this care gap. Now to come to cancer proper, what exactly is cancer? We all know that it's a broad term. It describes the disease that results when cellular changes cause the uncontrolled growth and division of cells. Now in the Indian scenario, 1.16 million new cases were there in 2018 and more are expected by 2025. In India, the 6 most common cancer types were breast cancer, oral cancer, cervical cancer, lung cancer, stomach cancer, and colorectal cancer. And WHO says that in their lifetime, 1 in 10 Indians will get cancer, which is a horrible, horrifying figure. So first, now we look at this from the gender, on a gender basis. So what are the common cancers in men? The commonest is oral, then lung, then stomach, then colorectal, then esophageal. These are ICMR 2021 figures. And in women, 103.6 per lakh women in 2020 have cancer, new cases, breast, oral, cervical, lung, and gastric. Breast cancer is the commonest cancer. ICMR is saying that oral has become second. So far, we have always treated as breast and then cervical. But the specific, because they are females, breast cancer, cervical cancer are the 2 biggest killers for Indian women among the cancer section. Now, we have to look out for the warning signs. Like, we have to be aware, like who has a chance of getting cancer, what kind of features can signal cancer. So, excuse me. Now, one early warning sign for cancer
One symptom that one mustn't ignore is unexplained weight loss. And now we'll look at the 8 signs. There are so many different cancers. We cannot actually lump them together as 8 signs, but these 8 signs speak for a lot of the very common cancers. The 8 signs to detect early stages of cancer are unusual bleeding or discharge, change in bowel and bladder habits, a sore that does not heal, nagging cough and hoarseness, decrease in weight, an obvious change in a mole or wart, indigestion or difficulty in swallowing, and lastly, a thickening or a lump. Now we can fit these signs actually to things like oral cancer of the mouth, the breast cancer, the lung cancer. But then we have to, because of brevity in time, we cannot talk of each cancer individually, but I shall try to highlight some of the most important ones. Now, this is a watchword, a mnemonic for these common warning signs, that is caution. Take caution, practice caution. Caution, C for change in bowel or bladder habits, A for the unhealing sore, U for the unusual bleeding, T for the thickening or lump, I for the indigestion, O for obvious change, and N for the nagging cough. It's easy to remember, caution. So now we come to the risk factors of cancer. Now these include the older age, a personal or family history of cancer, for example, breast cancer, using tobacco, for example, lung cancers, GIT cancers, obesity, alcohol, some types of viral infections like hepatitis B and human papilloma virus, specific chemicals, and exposure to radiation, including UV radiation from the sun. Now, cancer is preventable and treatable at certain levels. Now, leading causes of cancer are tobacco, infections, alcohol, obesity, and air pollution. These are lumped under the non-communicable diseases. Now, first of all, before I go into the female-specific cancers, I would like to talk about some of these important risk factors which are preventable causes of cancer. So first of all, we talk of tobacco and cancer. 16 cancers can be caused by smoking, and not just smoking, by other forms of tobacco also. So cancer of the lung, mouth, throat, nose and sinuses, esophagus, bladder, kidney and ureter, pancreas, stomach, liver, even cancer of the cervix, ovary, cancer of the colon, and acute myeloid leukemia. So this is showing us how mainly about smoking, but also of all kinds of exposure, all kinds of findings that can cause exposure to different cancers. Habits like smoking, chemical exposure, secondhand smoke, air pollution, radon exposure, lung diseases like COPD. Now we're coming to specifically, how does tobacco cause cancer? One moment, there's somebody in my house. I'll just ask him to stop making that noise. It's obstructing doors. One moment, please excuse me. आप लोग ये आवाज कम करो, मैं इसको दोनों दरवाजा बंद करो, दोनों दरवाजा बंद करो। How tobacco causes cancer? Tobacco smoke can causes mutagens and carcinogens from tobacco smoke, cause DNA damage, mutations, and change in DNA methylation, and leads to 13 different types, more than 13 different types of cancers that were highlighted in the previous slide. Now we know that 1 in 8 cancer cases are caused by smoking, and 1 in 5 cancer deaths are caused by smoking. So we need to know some facts about tobacco. Every time a person takes a puff of a cigarette, 7,000 chemicals enter into the lungs and spread to other parts of the body. There are 69 known different chemicals in a cigarette that are known to cause cancer. These are carcinogens. More tobacco facts. If tobacco smoking did not exist, lung cancer would be a rare disease. Now, smoking increases the odds of stomach cancer by 61%. And stomach cancer is one of the most common and deadly cancers in the world, especially for men. A large proportion of cancers of the mouth can be attributed to tobacco, including 60% oral cavity and pharynx, 70% in the larynx, and 60% esophagus. Now there is this entity, smokeless tobacco. What is this? Gudaku, Gul, Mawa, Kheni, Zarda, Maras, Naswar, Gutka, Zarda, Pan Masala, and Areca nut. These contribute as smokeless tobacco, but they are not unsafe. They are equally bad, equally unsafe, and they are specially responsible for mouth, tongue, cheek, and gum cancer, and cancer of the esophagus and of the pancreas. There is one moment, and there are specific substances that cause these cancers in these. So the next tobacco fact, there is a good finding as well. This is that it's never too late to quit smoking. The body starts to repair itself 6 hours after the last cigarette, and the risks of smoking will continually decrease after that. So anybody who quits is a winner. We keep saying, winners don't quit, but winners quit when it's a question of cigarettes. When they quit cigarettes, they become winners, because after 6 hours, their body starts going on the mend. Now, since we are talking prevention, so how to quit smoking? There are a number of methods, but basically it's following a healthy lifestyle, drinking more water, eating healthy food, quitting smoking, do not touch the cigarette, exercise, make a proper plan, avoid the situations that tempt us, and avoid other triggers like alcohol and cigarettes go together. Now, there are certain questions that we are very interested in about tobacco, and that is, what is the carcinogen? Is it nicotine? So earlier, everybody thought it's nicotine that causes the cancer. Now we are more educated. We say, no, it's not nicotine that causes the cancer. And now that we are even more aware, we know that nicotine is not the main thing, but nicotine is contributory. So nicotine is the major chemical component responsible for the addiction component of the tobacco products. It's what makes people addicted. So in many ways, it is the prime reason is nicotine. It's because people can't do without nicotine that they keep smoking. So TSNA, NNN, and NNK, they are the known carcinogens in tobacco. These are not nicotine. Now, nicotine was earlier thought to be solely a promoter of cancer and not a causative agent per se. New evidence indicates that nicotine may actually contribute to development of cancer. Now, this is something very interesting, because when I prepared this presentation for you, that I learned about this, because I'm a gynecologist. I'm not really into this in great detail. So I did not know for sure what exactly e-cigarettes were. It's when I made this presentation that I researched, and then I found out what e-cigarettes were. Because e-cigarettes, we are, as females, we are mothers and we are wives, and we need to know, because this new generation that's coming up in India has taken to e-cigarettes in a big way. E-cigarettes have swept the world, and they have entered society, especially high society in our country as well. So how do e-cigarettes work? E-cigarettes, they provide nicotine through an aerosol instead of through smoke, as with a tobacco cigarette. And puffing on the mouthpiece of the cartridge activates a battery-powered device. It's showing here in this picture. This heater then converts a liquid solution which contains nicotine flavors, and other chemicals into an aerosol, commonly called vapor, that the user inhales. The act of inhaling this aerosolized solution is sometimes called vaping. Now, this thing is of marked significance. Right now, the most popular e-cigarettes among teens is the Juul, and it contains as much nicotine. 1 Juul pod will contain as much nicotine as a pack of cigarettes. And e-cigarettes are being offered by advertisers and by their makers as an alternative to cigarettes because they say that they are not carcinogenic, which is not true. They are also carcinogenic. The high nicotine content is, as we have seen earlier, nicotine is itself also partially carcinogenic, and it builds a strong craving, this e-cigarette, and it keeps a person addicted to this nicotine of tobacco. And acrolein, a known ingredient of many cigarettes, causes irreparable lung damage. And the health faculty do not say that e-cigarettes are safe. So let us know a little about this and realize that e-cigarettes are also not a good option. The very sad thing about e-cigarettes is that often the liquid in them is candy flavored or like tastes like fruit juice, and this makes small children addicted to it. Now we have to be aware about the risk factors for mouth cancers, and I'll just mention them: tobacco, alcohol, our diet, certain fish. If fish is in a poisonous setup, it can cause cancer, although fishes are very good food otherwise. Then HPV, chewing or smokeless tobacco, and the environment. And what happens, what are the findings that we see in the mouth? Lumps, ulcers, bleeding, and loss of taste, etc. Now, prevention of cancers. You can help prevent many forms of cancer by quitting smoking, by staying out of the sun and using sunscreen regularly to prevent skin cancers, by following the safety precautions if we work with dangerous chemicals, use proper shields, use gloves, use every precaution, by not having unprotected sex. The very use of a condom can save somebody from cancer, to avoid sharing needles, especially in things like hepatitis B, to get the vaccine that prevents hepatitis B infection if you're at risk for it, get the vaccine that prevents HPV infection if you're at risk for it. If we drink in moderation, eat a balanced diet, exercise, and maintain a healthy weight. Now, coming to cancer in India in 2020. Among women, breast cancer is estimated to contribute 2 lakhs, that is 14.8%, and cervical cancer, 0.75 lakhs, that's 5.4%. Whereas for both men and women, cancers of the GIT are estimated to contribute 2.7 lakhs of the total cancer burden, ICMR 2020 figures. Now we shall talk about breast cancer. First breast cancer, then cervical cancer. Now breast cancer. Why is the incidence of breast cancer rising in young Indian women? Health facilities are improving, but the incidence is rising. Why? Because of these reasons: genetic and hereditary reasons, sedentary lifestyle because of a certain amount of development in India, late or no pregnancy has become a choice for women nowadays, use of the oral contraceptive, early start to menstruation, and a late menopause, excessive intake of alcohol, smoking, increasing obesity amongst youngsters, stress, and poor dietary intake. So these are the risk factors and prevention, and with prevention shown on the other side. So first, the risk factors. The incidence is much higher in females of breast cancer than the male, but the male is not immune to breast cancer. Incidence increases especially after the age of 40. 5 to 10% cases of breast cancer have a genetic background. We know of those 2 genes, BRCA1 and 2. Before 12 years of age, if one has menarche, there is a chance, this is a risk factor for breast cancer. Any kind of family history in breast cancer, late menopause after 55 years, and exposure to radiation. And what are the things that prevent breast cancer? And what are the, when women, can you hear? Am I audible still?
Yes, doctor, it's quite.
Now, having no children is also a risk factor. Incidence decreases when women give birth. Childbirth is protective, and so is breastfeeding, and so is lactation. Giving birth at an older age, after 35 years of age, that is bad. Not breastfeeding, that's bad. Using HRT to treat menopausal symptoms. Now, this is a big topic, but at a certain levels, it is bad for breast. It does cause breast cancer. Eating lots and lots of processed and fatty foods, and hormonal birth control methods. Now, the ones above, they were not controllable risk factors, the upper lot. But the ones below, these are perfectly controllable. So there's a lot that one can do for prevention, and that is exercising, maintain a healthy weight, limit alcohol intake, etc. Now I shall just mention the two genes that are associated with breast cancer, BRCA1 and BRCA2. They are associated not only with breast cancer, but also with ovarian cancer, prostate cancer in the male, and pancreatic cancer in both. And breast cancer, BRCA1, 50 to 65%, and BRCA2, 40 to 55%. If the gene is present, there's a chance of cancer. Similarly, a high incidence in ovarian and testicular. So now we come to what can we do to screen for breast cancer? Now, a few years ago, self-breast examination was touted a lot. Like one can prevent breast cancer by self-breast examination. Now, new work shows that not so many cases are reduced by it. But still, if during self-breast examination, if a woman finds a lump in her breast, and if she finds untoward findings, definitely the reporting of it will help to restrict breast cancer at that level. Now, the purpose of breast screening is to find breast cancer at the very earliest, when the treatment is known to show best results. Now, self-breast examination, I'll do that slightly more detailed in the next slide. More than 20 years girls should do it monthly according to the menstrual cycle. Clinical breast examination should be for 20 to 30-year-olds every year, for 30 to 60 years every 6 months, and for more than 60 years every year. Now, the screening mammogram is only done if the initial baseline mammogram shows that there is increase in the breast density. Screening mammogram, less than 40 years, ultrasound for evaluation of any suspicious findings on clinical breast examination, 40 to 55 years, annual mammogram. Mammogram is not an ultrasound. Mammogram is an X-ray. 55 to 70 years, mammogram every 2 years. This is the accepted protocol for screening for breast cancer. Now here, I want to show you the self-breast examination. I have put the slide in Hindi so that it's easier. Some people can save it for that purpose to show to your public. And the main thing is a woman has to stand in front of the mirror and do these tests with her hands put up in this fashion. And it should be done just after the period, 1 week after the period, when the body is the most sensitive. And she must palpate the nipple and look for lumps beneath the nipple. She must see if both breasts look similar, if one breast is different from the other, if there are any unusual colorings or fixity of the skin of any breast. These are signs of advanced breast cancer. But just by looking, just by an abnormal look in also, she can see that something is wrong. Then when she palpates the nipple and she finds an unusual discharge, whether it be milk or blood or water, it must be reported to her. She must consult a doctor. Then when she sits, she must palpate with 3 fingers, not just with a single finger. So there's less chance of missing the lump. And last of all, she has to lie down and check again and repeat the same things repeated in the lying down position. And if ever she finds a lump or an unusual discharge, if she's feeling pain, all these are something to report. Now we come to the mammogram. Now the mammogram is an X-ray picture of the breast. Doctors use a mammogram to look for early signs of breast cancer. Regular mammograms are the best tests doctors have to find breast cancer early, sometimes up to 3 years before it can be felt. So now we have to have this change in our way of thinking, and we have to realize that a mammogram is the best screening test. So it is an X-ray picture of the breast, and there are 2 types, the 2D and the 3D. There's a big difference in the prices. So ever since 3D came up, there's been a lot of pressure that you shift from 2D to 3D. But there is not such a market difference between the two. And the 2D digital mammogram also tells a lot. So the 2D digital mammograms that most women receive typically provide front and side images. For the 3D test, the X-ray arcs across the breast, creating multiple images of breast tissue. The experience is the same for women, though, as both scans involve compressing the breast between 2 plates extending from the machine. So now we can compare 2D mammogram versus 3D mammogram. Studies have generally shown that the 3D test is slightly better at detecting cancers than the 2D one. And also women have to come back less often to have extra images taken. But the jury is still out on whether the newer technology is any better at identifying the advanced cancers that will become lethal. So now, generally when we go to doctors, the doctor tells you get an ultrasound of the breast done. They don't say go and get a mammogram done, because they palpate and they look for lumps, they don't find it, and they say, okay, go for the ultrasound. Now, is ultrasound better than mammography? Breast ultrasound is more accurate than mammography in symptomatic women 45 years or younger. Mammography has progressive improvement in sensitivity in women 60 years or older. The accuracy of mammograms increases as women's breasts become fattier and less dense. Now, breast ultrasound is not currently a recommended screening tool for breast cancer because it can miss many of the early signs of a tumor. Now, very briefly, we touch on the treatment. Okay, we have tried to prevent it. We have not been able to prevent it. So what are the treatment options? So I'll just name them: surgery, radical lump removal, radical full breast removal, etc. I don't think that's in the purview of today's discussion. Just mention one word: surgery. Then chemotherapy, using special medicines like tamoxifen, etc. Hormonal therapy, biological therapy, it increases the body's immune system, and radiation. High energy rays, similar to the X-rays, which will kill the cancer cells. So now from breast, we move to cancer cervix, another of the very major cancers in women. Luckily, the incidence of cancer cervix is going down in India, but what is there is still horrifying, horrible, and very sad because it is a preventable cancer. It is a sexually transmitted disease. Okay, we'll come to that. In India, cervical cancer contributes to about 6 to 29% of all cancers in women. The age-adjusted incidence shows highest in Mizoram, lowest in Dibrugarh, not so far apart. Indian women face a 1.6% cumulative risk of getting cancer cervix and a 1% death risk from it. See, this is showing where the cancer occurs. Now, the horrifying facts of cancer cervix: more than 200 women die every day, 8 women die every hour, and every 7 minutes a woman dies. So this cause of cancer cervix needs to be taken up by multiple stakeholders. So cancer cervix, it is a sexually transmitted disease. It is caused by the human papilloma virus. It is a necessary, HPV is a necessary cause of cervical cancer, seen in 99.7% cases. So think how sad it is if it can be avoided by so many practices that prevent the transmission, the sexual transmission of this disease. Incidentally, it also causes anogenital warts and cancers in men. So now, what are the symptoms of cancer cervix? So the most significant, the most important one is if there is postcoital bleeding. That is something for which somebody should run immediately, get it checked, because it is one of the commonest causes of, commonest symptoms of cancer cervix, pain or bleeding after intercourse. Another important one, if there is a foul smell from the vagina, it is a sign of late cancer cervix. There is a typical smell. When you see that patient, the patient lies down, we just put the speculum to see the patient, and the smell can help you diagnose. It's one of the questions we were asked as students. Name a disease you can diagnose by smell, and it is cancer cervix. Now we come to the screening of cancer cervix. We all know a lot about pap smear. The pap smear is a screening test for cancer cervix, and there are others as well. Now pap smear, in a pap smear, we apply a speculum and we take a small scraping from the cervix, from the part where we expect the cast off cells, called the exfoliated cells, to be received, and that you put into a special, make into slides or do liquid cytology and save, and then see it through a microscope. And then from the kind of cells that you see, one can see that its person is going to develop, the person has precancerous condition, and maybe later she will develop cancer cervix. Cancer cervix is one of those cancers which has a marked precancerous set of conditions, earlier called CIN 1, 2, or 3, or called mild dysplasia, moderate dysplasia, severe dysplasia, and it's only after these that one gets cancer proper. So if by the medium of pap smear, you can identify this, you can identify it in the precancerous condition, a woman can be saved before the cancer has gripped her. So kisko karna chahiye pap smear? Let's go on with this. So this is roughly showing how the pap smear is done, and who has to, what are the recommendations? Before 21 years of age. This is actually a general recommendation for all over the world. It says under 21-year-olds need not. But seeing that nowadays there is so much so much sexual promiscuity, and a woman's sex life begins much before 21 years, this recommendation is perhaps not quite right, that no testing is needed. 21 to 30 years, pap smear is done every 3 years. Now, it takes some time for precancer to develop after sexual exposure to HPV. That is why it is assumed that under 21 years, a person will not be showing the results of HPV infection. And so it is said that no testing under 21. But suppose a girl starts sexual activity at the age of 13, she is definitely at risk at 21. Now, 21 to 30 years old, pap smear every 3 years. 30 to 65 years, pap smear every 3 years, and HPV every year. At 65 years old or older, no testing is needed. Now, there is something called VIA. VIA is visual inspection with acetic acid. Acetic acid is nothing but the household vinegar, the straightforward, clear household vinegar. If you apply that over the cervix, there are certain changes in the tissue of the cervix, which becomes white. We call it aceto-white. And this highlights the regions of the cervix that are expected to get the cancer, that have a chance of getting cancer. So by just seeing aceto-white areas, it is an indication where nothing else is available, this can be done. Just by this simple treatment, it will show. And VIA can also be a contributory treatment. You do VIA and then you do the pap smear, or then you do the colposcopy after that. And then you have these highlighted areas post VIA in which there is more chance of getting positive findings. So what is the meaning of VIA in cervical cancer? Visual inspection of the cervix with acetic acid is an ineffective, inexpensive screening test that can be combined with simple treatment procedures for early cervical lesions provided by trained health workers. One can even have an attached cryotherapy unit over there. And suppose one does a camp, we can even do that, you do the VIA and cryotherapy is freezing that section, which is aceto-white, and that will help to decrease the cancer. Now, since HPV has been highlighted, human papilloma virus has been highlighted as the cause of 99.7% cancer cervix. Therefore, HPV DNA test is coming up in a big way. In this, the sample collection is taken during a gynae examination, and the health worker puts in a speculum, removes a sample of cervical cells with a cytobrush, and sends it for cytology. And if the HPV DNA is seen, the person is at risk. Now, colposcopy. Colposcopy is a procedure. It is shown here how the colposcope is used and is trained on the cervix. And it is a procedure to closely examine the cervix, the vagina, and the vulva for signs of disease. During colposcopy, the doctor uses a special instrument called a colposcope. And after this colposcopy, the doctor may recommend a pap smear test if the results are abnormal. Now, what are the risk factors for cancer cervix? The known risk factors: HPV, then low socioeconomic status, smoking, marrying before the age of 18 years, young age at the first coitus, multiple sexual partners, and multiple sexual partners of the spouse, because the spouse will also bring infection, HPV infection, to the wife. If the husband is infected, and if the husband has multiple sexual partners, the husband will bring HPV infection and does infect the wife, and multiple childbirths. The reason for all this is, why are these risk factors? Because at young age, the cervix is especially vulnerable to traumatic infection and to the infection, and this predisposes to the HPV infection. It is a place where it's easy to get HPV infection following the trauma of early sex and sex at an early age, multiple sexual partners, etc. Now, expressed in a more social way, what are the risk factors for cancer cervix? Having many children, 2%. Not going for regular smear or pap smear, 4%. Infection with HPV, 28% as a risk factor. Smoking, 15%. A weak immune system, 17%. Long-term use of oral contraceptive, 12%. Many sexual partners, 7%. Starting to have sex at a young age before the age of 17, 15%. This should not have been labeled colposcopy, I made a mistake. So now, cancer cervix screening and diagnosis. We have done the screening, talked about the screening in some detail, the pap smear, the HPV, and because some cancer cervix is within the cervical canal that is diagnosed, not screened. It is diagnosed by an endocervical curettage and by a cone biopsy, which takes away a big chunk out of the cervix and a cone-shaped chunk and sends it for histopath examination. So now we come to prevention of cancer cervix. 1. Avoid promiscuous sexual activity. Use condoms or other contraceptives during sex. Quit smoking. And of course, vaccination. So we need to be cervical cancer aware. So how to reduce your risk of cancer cervix? A number of changes to your lifestyle. Please shut it down. A number of changes to your lifestyle can significantly reduce your risk of cancer cervix. One of the most important of these is to get a vaccination. So we can prevent cancer cervix in 3 simple steps. Vaccinate, pap smear, do the HPV test. This is if a person is vaccinated, despite exposure, there is a strong chance of avoiding the cancer. The pap smear is if a person has got the pre-cancer condition, the cervix can be treated, removed, maybe the uterus removed before the person gets the cancer. And the HPV test to see if a person, how much the load of the HPV infection is. Okay, this is a repeat, sorry. So HPV vaccine. The sad thing is that India has no national policy of giving HPV vaccine, at least to the young girls of India, because HPV vaccine is expensive. If it became a policy, just like oral polio drops are a policy and 2 Tetvac injections in pregnancy are a policy, if all girl children in India receive the HPV vaccine, the load of cancer cervix, a burden of cancer cervix would decrease. So do we have HPV vaccine in India? Since 2008, 2 HPV vaccines have been made available in India. One, a quadrivalent vaccine called Gardasil, which protects against 4 strains of HPV, and a bivalent vaccine called, sorry, this is a spelling mistake, Cervarix, which protects against 2 strains. Both these vaccines offer protection against the high-risk strains HPV 16 and 18. So what is the schedule of HPV vaccine? At the age of 9 to 40 years, 2-dose HPV vaccine, first at 0 and then at 6 to 12 months. Then at the age of 15 to 26, 3-dose, first the starting dose, then one after 1 to 2 months, and then again after 6 months. Age 21 to 26 years for the male, the 3-dose regimen, and 27 to 45, it is not universally recommended. So the 2 different kinds of HPV vaccine, one is Cervarix. In this, there are 3 doses of 0.5 ml. They are always given IM. Schedule is at 0. Then after 1 month, after 6 months, given in the deltoid muscle of the upper arm. The other one, Gardasil, now has come up with a new form, not just Gardasil, the 4 quadrivalent one, but there is now a 9-valent one also. It deals with 9 strains. Is it much better? It should be a little better because there are 5 additional strains addressed. So now, the treatment of cancer cervix, again, I shall be very brief about this particular one because this is a big subject and it's not about awareness, it's about treatment proper. It depends upon the stage of the cancer cervix, surgery, and in latest and side-by-side radiotherapy. Radiotherapy is as good as surgery in the beginning and better in the later stages. Chemotherapy for the later stages, and for the very early stages, targeted therapy, and again in the late stages, targeted therapy. So now, when it's cancer cervix, close the gap. All women should be able to get treatment for cancer cervix. And now it's time to end cancer cervix. Get vaccinated and screened. So, as I come to the end of this talk, we say one of the slogans for this year is find a cure. Finding a cure is our goal. Spreading awareness plays a role. So on this World Cancer Day, 4th of February, we can come up and say together, it's possible. Thank you very much.
Thank you, Dr. Kavita, for explaining everything and all the aspects of cancer, including risk factors and all. Thank you very much. And guys, if you have any query, you can ask Dr. Kavita.
Anju, in meantime, Sarita ji has joined. Just
welcome, welcome, Sarita ji. Sarita जी के लिए मैं एक लाइन बोलना चाहूंगी.
Thank you so much.
रौनक दमक उठती है, नूर फैल जाता है जब महफिल में आपसा कोई कदम रखता है. Thank you, Sarita ji.
क्या बात है. Thank you so much, Anju. Thank you.
Welcome, Sarita ji.
Welcome.
And now, if anyone has any question, yes, please raise your hand. मैं mute का prompt
Thank you so much.
किसी को कुछ पूछना है तो आप हैंड रेज कर सकते हैं. मैं अनम्यूट कर दूंगी. आई थिंक डॉक्टर प्रिया ने इतने अच्छे से एक्सप्लेन किया है.
बहुत अच्छे से एक्सप्लेन किया.
किसी को कुछ पूछने की जरूरत नहीं है. तो देयर इज नो क्वेरी. तो शैल वी मूव अहेड अंजू?
हाँ, मुझे कुछ पूछना है निभा. कुछ पूछना है निभा.
यस सरिता जी.
नमस्ते डॉक्टर साहब, आपने बहुत अच्छे से
Thank you so much. Thank you.
जानकारी दी और बहुत
सरिता जी, आपका नेटवर्क इशू है, आवाज नहीं आ रही है, वाइब्रेट हो रहा है.
I'm sorry, I couldn't understand.
बिल्कुल आवाज नहीं आ रही है.
सरिता जी, आपका थोड़ा सा नेटवर्क इशू है. अंजू, आप कॉल करके बोलेंगी सरिता जी को?
बोल देते.
शायद वो निकल भी गई शायद उनका. हाँ, मे बी शी विल जॉइन अगेन.
हाँ 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 हाँ.
तो
कनेक्ट कर रही हूँ.
थोड़ा वेट कर लेते हैं उनके लिए.
हाँ, कर लेते हैं. बहुत अच्छे से समझाई, लेकिन कविता जी हम लोग आ गई. सरिता मैम आ गई. सरिता जी
अभी आवाज आ रही निभा?
सरिता जी अभी ठीक है.
अभी ठीक है. डॉक्टर साहब, मैं पूछना चाह रही थी कि आपने कहा कि 65 इयर्स के बाद पेप्समेयर की जरूरत नहीं है, तो क्या उसके बाद ये घट जाता है क्या रिस्क सर्वाइकल कैंसर का?
इनकी आवाज नहीं आ रही.
किसी को डेवलप करे तो अगर 65 इयर्स तक किसी को नहीं हुआ तो इट्स नॉट एक्सपेक्टेड, बिकॉज इट्स अ सेक्सुअली ट्रांसमिटेड डिजीज एंड बिकॉज इट टेक्स 5 इयर्स टू डेवलप कैंसर सर्विक्स. उसके पहले तक अगर पर्सन स्क्रीन्ड है, इट डजंट मीन कि आप पहले बार 65 के एज में ही शुरू करो अवेयरनेस. इफ सो फार द पर्सन हैज बीन स्क्रीन्ड एंड इज नेगेटिव, then that person can stop getting its further screening. There is no need to go on for more screening. नहीं तो ऐसा होता है कि हिस्टेक्टमी के बाद भी पैप्समियर टेस्ट का एडवाइस किया जाता है. अगर वॉल्ट में डर रहे कि कुछ है, सर्विक्स तो चला गया, निकल चुका हिस्टेक्टमी पर अगर डिस्चार्ज मिल रहा है, कुछ फाइंडिंग मिल रहा है, तो स्टिल हम लोग एडवाइस करेंगे कि पैप्समियर करो, इवन एट द एज ऑफ 70. But the meaning, the protocol is that at 65, in a person who has so far not got anything, a person can stop going in for the regular screening. हमारे देश में every year तो होता ही नहीं है, which is so sad. So these screening advices are not actually applicable to us. हम लोग तो 10 साल में एक बार भी screen कर लें, we think we are very great, which is wrong. But in developed countries, the incidence of cancer cervix is so low because they are doing all this and plus they are doing the vaccination.
Thank you, doctor. I think
so much.
network.
breast hang करके
ये और किसी को कुछ पूछना है? हाँ, ये पूर्वी घोष अपना हैंड रेज कर रही हैं।
अच्छा, मैं उनको भेजती हूँ।
हाँ,
पूर्वी अनम्यूट करिए। शी इज फ्रॉम आवर क्लब, मेंबर ऑफ IWC जमशेदपुर वेस्ट।
ओके।
हाँ पूर्वी, अनम्यूट करिए।
अनम्यूट कर रहे हैं।
यस यस, आ रही है आपकी आवाज।
आ रही ना?
हाँ,
The host is not allowing.
नहीं नहीं,
Okay.
आपकी आवाज आ रही है,
अच्छा।
मैंने अनम्यूट कर दिया आपको।
Okay. First of all, good evening to everyone. And so nice this cancer awareness program for everybody. And all the respected members of this हमारे इनरव्हील क्लब, सभी को मैं बहुत बहुत तहे दिल से आभार प्रकट करती हूँ। माय क्वेश्चन टू डॉक्टर कविता मैम कि अभी जो कोरोना के समय लोग वैक्सीन ले रहे हैं, तो सर्वाइकल कैंसर का जो डोज दो होता है, इसका कुछ गैपिंग, चाहे ये वैक्सीन लेने के बाद कोरोना का कितना दिन के बाद ये लिया जा सकता है? इन दिस रिगार्ड आई जस्ट
बहुत स्ट्रॉन्ग गाइडलाइंस नहीं है, बट एक साथ दोनों नहीं लेना है। कभी भी दो वैक्सीन को एक साथ नहीं लेना है, तो कम से कम 15 डेज गैपिंग करना उचित होगा। बट एज सच एग्जैक्ट गाइडलाइन नहीं दिया हुआ है कि आप इतने दिन के बाद ऐसे करके लो। मगर जैसे हम लोग टेटवैक भी एक साथ नहीं देने देते हैं, बिकॉज प्रेगनेंसी में अलाउ कर दिए कोरोना वैक्सीन, मगर जैसे टेटवैक भी अलाउ नहीं कहते कि एक साथ दोनों ले लो। सो हमेशा दो वैक्सीन के बीच में 2 डिफरेंट वैक्सीन, कम से कम 15 डेज गैप होना चाहिए।
ओके ओके, थैंक यू मैम, थैंक यू वेरी मच।
गुड
But
इन्फॉर्मेशन।
these are not government guidelines yet.
ओके मैम, थैंक यू वेरी मच।
अंजू,
नो क्वेश्चंस?
आई डोंट थिंक सो।
ओके, अब थोड़ा माहौल को हम ये बनाते हैं, म्यूजिक लाते हैं उसमें। As we know, music is life itself. Music is the soundtrack of life. Music is love. Music is the shorthand of emotion. Music is the wine that fills the cup of silence. So now, Jyoti, now we have Inner Wheel Club. Karachi is presenting a beautiful song for us.
Anju, can you tell me the name of the member?
I think there's one Ritu, nahi.
रिंकू जी हैं।
Rinku.
Yes, yes. But she is not in the meeting right now. Maybe उनका कुछ
she was there, but
yeah, she was there. मैंने उनको co-host भी बनाया था, but right now she, इसलिए मैंने आपसे नाम पूछा once again. But right now she is not in.
then how to connect her?
ओके,
We can move ahead. अगर इसके बाद वो मुझे मिल जाएंगे तो then I will spotlight. ठीक है? तो next agenda पे बढ़ते हैं।
हाँ। Every thought that you produce and anything that you say and any action that you do, it bears your signature. She is none other than our PDC Sarita Prasad. And for this, I would like to invite Manju Prakash of Bihar Sharif, IWC Bihar Sharif, to say a few words for
मंजू।
थैंक यू मंजू। हमारी चीफ गेस्ट सरिता पीडीसी सरिता प्रसाद मैम का मैं तहे दिल से स्वागत करती हूँ। बाकी सभी लोगों का भी मैं तहे दिल से स्वागत करती हूँ। मैं मंजू प्रकाश, इनर व्हील क्लब ऑफ बिहार शरीफ की प्रेसिडेंट, इनके बारे में एक छोटी सी जानकारी देती हूँ। ये पटना विश्वविद्यालय से स्नातक एवं एमबीए किया। वर्ष 2003 में इनर व्हील क्लब पटना क्लब की सदस्यता ली। ये सत्र 2008-9 में प्रेसिडेंट एवं 2019 और 20 में डिस्ट्रिक्ट चेयरमैन रही। ये अभी तक की 3 ट्रेनियल कॉन्फ्रेंस, एक साउथ एशिया रैली, 2 IIW कॉन्वेंशन की हिस्सा रही। इनका विवाह स्वर्गीय सुधीर प्रसाद से हुआ था और इनके 2 बच्चे हैं, बेटा श्रीधर और बेटी सुभाषिनी। ये वर्तमान में इंडियन ऑयल कॉरपोरेशन का LPG डिस्ट्रीब्यूटरशिप चला रही हैं। ये बहुत ही शालीन और शांत है। इन्हें संगीत, तैराकी, खाना बनाना, यात्रा करना, किताबें पढ़ना, बागवानी करना एवं सभी लोगों से फ्रेंडशिप करना बहुत अच्छा लगता है। इनकी आवाज इतनी सुरीली है कि अगर कोयल को देख ले तो एक सरिता मैम एक बार जरूर याद आती हैं क्योंकि इनकी आवाज कोयल जैसी बहुत ही सुरीली है। थैंक यू सो मच मैम।
थैंक यू मंजू।
Anju, please invite Sarita ma'am to speak.
Now I request Saita ma'am to say a few words to address the public.
थैंक यू। उर्वशी वर्मा, अंजू ढिंगरा, अंशु और नीता नारायण, सभी प्रेसिडेंट को बहुत बहुत थैंक्स कि आपने मुझे बुलाया आज के दिन। आज वर्ल्ड कैंसर डे है और आज के दिन अगर हम लोग कैंसर की कुछ बात करें, कुछ अवेयरनेस फैलाएं तो इससे बड़ी बात और क्या होगी। और हम लोग सब जानते हैं कि बेस्ट प्रोटेक्शन इज अवेयरनेस। अवेयरनेस किसी भी सुरक्षा की पहली सीढ़ी है और हम खुद भी अवेयर हो और दूसरे को भी अवेयर करें, ये हमारा हमेशा से उद्देश्य रहा है। और हमने बहुत काम किया है अभी तक, पिछले 5 महीनों में बहुत काम किया है और आगे भी जो काम आने वाला जो महीना है उसमें भी हम लोग बहुत सारा कैंसर अवेयरनेस का इस तरह से करेंगे भी। और फील्ड में जाकर, अब कोरोना शायद खत्म हुआ है, कोविड हम लोग को इतना अलाउ करे कि हम लोग फील्ड में जाकर के अवेयरनेस फैलाएं और लोगों को जागरूक करें। डॉक्टर कविता प्रिया, आपने बहुत ही इम्पोर्टेंट जानकारी दी। हम लोगों ने बहुत सा वेबिनार अटेंड किया था, लेकिन कुछ बातें आपने जो बताई वो हम लोग के लिए बहुत अच्छा था। HPV वैक्सीन शेड्यूल आपने बताया, वो हम डिटेल में नहीं जानते थे कि किस एज में कैसे लगना चाहिए, वो बताया।
नेटवर्क इश्यू।
और आज के दिन आज पटना में हम लोगों ने एक अवेयरनेस जागरूकता अभियान शुरू किया है। सिग्नेचर कैंप को मैंने निभा को भेजा है। मैं कहना चाहूंगी कि आप लोग भी अपने अपने शहर में इस तरह से अवेयरनेस का कैंपेन करें, क्योंकि 15 फरवरी चाइल्ड कैंसर डे है। तो हम लोग आज से शुरू करके उस दिन तक हम लोग खत्म करेंगे। और आज गांधी मैदान पटना का जो बहुत ही सेंट्रल प्लेस है, वहां पे हम लोगों ने ये कैंपेन शुरू किया है। और कैंसर के लक्षण का ऐसा पोस्टर बना के हर जगह लगाया है और उस कैंपेन से में भी कुछ बातें लिखी है और उसका सैंपल मैं भेजूंगी। और निभा से रिक्वेस्ट है कि निभा तुम शेयर करो अगर तुम्हारे पास है तो।
Yes, Sarita ji, just
हाँ हाँ।
एक तो ये है।
हाँ, एक तो आज हम लोगों ने IWC पटना ने एक कैंसर हेल्पलाइन नंबर इनॉग्रेट किया है। ये हमारे डिस्ट्रिक्ट के सब क्लब के सब मेंबर्स के लिए है। अगर आपको कोई भी दिक्कत हो, क्योंकि पटना में ही सेंटर है कैंसर के लिए, तो जैसे ही आपको किसी मरीज की जानकारी मिलती है और वह अपना इलाज पटना के किसी कैंसर हॉस्पिटल में करवाना चाहता है, तो उसका डिटेल लेकर आप तुरंत इस हेल्पलाइन नंबर पे हमें संपर्क भेजिए। फिर हमारा यहाँ से कैंसर प्रोजेक्ट की चेयरमैन शोभा सिंह है जो आपको गाइड करेंगी और कैसे एडमिशन होना है और कैसे हमारा गवर्नमेंट का जो स्कीम्स है उसका क्लब के मेंबर्स मिलके आपको सपोर्ट करेंगी। कोई भी हमारे डिस्ट्रिक्ट की, कोई भी शहर की, कोई भी मेंबर, ये सबके लिए आज हम लोग ये वाला हेल्पलाइन नंबर निकाले हैं, और इसको हम लोग व्हाट्सएप ग्रुप्स में भी डाल देंगे ताकि सबके पास हो जाए, अवेलेबल हो जाए, तो ज्यादा से ज्यादा मेंबर जिसका बेनिफिट उठा सके। इसलिए हम लोगों ने आज ये किया है। ये हम लोग आज जगह जगह हम लोग एक सवेरा कैंसर हम लोग हॉस्पिटल के साथ ये जॉइंट प्रोजेक्ट कर रहे हैं। ऐसा इंफॉर्मेटिव बैनर्स हम लोग हर जगह लगा रहे हैं, और आप भी अपने शहर में लगाइए, अपने क्लब का नाम डालिए, और अगर कोई हॉस्पिटल अगर आपके साथ मिलके काम करना चाहता है तो उसका डालिए, नहीं तो आपको कोई हॉस्पिटल का नाम देने की जरूरत नहीं। एक और स्लाइड है, ये सारा सैंपल हम भेज देंगे आपके व्हाट्सएप पे ताकि आप लोग उसको निकलवा करके जगह जगह लगा सकें। एक और स्लाइड है निभा। हाँ
यस
हाँ, ये हमारा सिग्नेचर कैंपेन है, ये हम लोग अभी गांधी मैदान के पास शुरू कर दिए हैं। काफी मेंबर्स उसमें मेंबर्स भी हैं, बाहर के लोग भी आके अपना साइन कर रहे हैं। और ये मैंने ही लिखा है, ठानी है हमने बुलंद है इरादे, रुकेंगे ना हम जब तक कैंसर को हरा दें, थोड़ी सूझबूझ थोड़ी समझदारी, सकारात्मक सोच थोड़ी सावधानी, भूले नहीं अब सबला नहीं है नारी, शिक्षा संयम कर मठता है पाई, मित्रता सेवा सौहार्द इनर व्हील ने है सिखाई, माना लंबी है लड़ाई, रुकेंगे ना हम जब तक मिलकर कैंसर को दे विदाई। तो ये सैंपल भी मैं डाल दूंगी, आप लोग अपने शहर में अपने क्लब के नाम के साथ ये कैंपेन आप लोग भी चला सकती हैं अवेयरनेस का।
बहुत सुंदर सरिता जी,
हाँ तो
बहुत अच्छा लिखा आपने।
थैंक यू सो मच। एक कोशिश छोटी सी कि हम लोग भी अपने को भी बचा सकें और दूसरों को भी बचा सकें।
नहीं सरिता दी, धनबाद में जगह
और
जगह पे लगवाएंगे पोस्टर, बहुत अच्छा है, बहुत अच्छा है,
अच्छा
मजा आ गया।
हम आप भेज भी देंगे। हाँ
हाँ हाँ
क्रिस्टल
एकदम
ग्रुप
भेज
में भी डाल
दीजिए।
देंगे, और जिसको
हाँ
हाँ
एकदम
हाँ, और
लगवाएंगे,
हम लोग
बहुत अच्छा।
हाँ, हम लोग अपने एरिया में भी लगाएंगे, यहाँ बिहार
हाँ
शरीफ में।
चलो। और थोड़ा सिग्नेचर कैंपेन से क्या होता है ना कि एक्टिविटी इंटरएक्टिविटी भी बढ़ती है ना, इंटरएक्शन भी बढ़ता है, आप वर्बली समझा सकते हैं लोगों को, तो इसलिए हम लोगों को लगा कि हम लोग ये करें। चलो बहुत अच्छा प्रोग्राम था, बहुत ही अच्छा, बहुत इंफॉर्मेशन मिला, सब लोग लाभान्वित हुए होंगे, और डॉक्टर साहब को बहुत बहुत धन्यवाद, मैं पूरी डिस्ट्रिक्ट की तरफ से आपको धन्यवाद देती हूँ। थैंक यू सो मच।
थैंक यू सरिता दी। रिंकू घोष नहीं आई ना अभी तक?
एक बार और देखती हूँ, ये माला है, कोई हैंड रेस किया था मैंने।
हाँ, रिंकू बैनर्जी इज देयर।
हाँ यस, अभी कर रही हूँ उनको, होस्ट कर रही हूँ उनको, स्पॉट पे ले रही हूँ। माला जी आपको कुछ पूछना है क्या? नहीं, वो शायद ठीक है। रिंकू जी प्लीज अनम्यूट योरसेल्फ।
I request Rinku Banerjee from Sunrekha Ranchi to present a beautiful song.
आज के इस मीटिंग में उपस्थित सभी को मेरा सप्रेम नमस्कार। मैं स्वर्णरेखा रांची से रिंकू बैनर्जी। जैसे आज की मीटिंग कैंसर के ऊपर है, मेरी आवाज सुनाई दे रही है?
अब डालेंगे, मेरा
हाँ,
जो
हाँ,
मीटिंग चल
बिल्कुल।
रहा है इसके बाद डालते हैं, थोड़ा सा मीटिंग अब खत्म हो रहा है, बस डालते हैं। आप तो कभी डालते नहीं हैं सब।
मैं बोलूं?
यस यस।
हाँ, तो जैसे आज की मीटिंग कैंसर के ऊपर है, और हम सब जानते हैं कैंसर एक जंग है, इसमें लड़ना पड़ता है, लड़के जीतना पड़ता है, और कोई भी जंग को जीतने के लिए हौसला की जरूरत होती है। अगर अकेला चलना भी पड़े, हौसला हारना नहीं होता है। इसी भाव को मद्देनजर रखते हुए मैं गुरुदेव रविंद्रनाथ टैगोर की एकला चलो रे की हिंदी वर्जन, जो कोलकाता के दाऊलाल कोठारी जी ने करीब 150 रविंद्र संगीत को हिंदी में अनुदित किया, और उनके इस अनुवाद, इस गाने, हिंदी गाने को अनूप जलोटा, मन्ना दे, आरती मुखर्जी से लेकर बहुत सारे हस्तियां गाए हैं। तो दाऊलाल कोठारी जी के अनुवाद से गुरुदेव रविंद्रनाथ टैगोर के ये गीत मैं गाने की कोशिश कर रही हूँ। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। चल अकेला चल अकेला चल अकेला चल अकेला रे। ओ फिर चल अकेला चल अकेला चल अकेला चल अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। यदि कोई भी ना बोले ओरे ओरे ओ भागे, कोई भी ना बोले, यदि सभी मुख मोड़े रहे सब डरा करे। यदि सभी मुख मोड़े रहे सब डरा करे, तब डरे बिना तेरे मन की बात मुक्त कंठ कह अकेला रे। तब डरे बिना तेरे मन की बात मुक्त कंठ कह अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। यदि लौट जाए सभी ओरे ओरे ओ भागे, लौट जाए सभी, यदि गहन डगर चले देखे मुड़ के ना कोई। यदि गहन डगर चले देखे मुड़ के ना कोई, तब राहों के कांटे ओ तू रक्त रंगे चरण तले दल अकेला रे। तब राहों के कांटे ओ तू रक्त रंगे चरण तले दल अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। यदि दीप ना धरे ओरे ओरे ओ भागे, दीप ना धरे, झड़ी आंधी भरी रात में घर बंद यदि करे। झड़ी आंधी भरी रात में घर बंद यदि करे, तब वज्र शिखा से तू अपनी अस्थियां जला और जल अकेला रे। तब वज्र शिखा से तू अपनी अस्थियां जला और जल अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। चल अकेला चल अकेला चल अकेला चल अकेला रे। ओ तू चल अकेला चल अकेला चल अकेला चल अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। चल अकेला चल अकेला चल अकेला चल अकेला रे। तेरी आवाज पे गर कोई ना आए तो फिर चल अकेला रे। नमस्ते।
बहुत अच्छा,
बहुत अच्छे रहे।
बहुत अच्छा रिंकू दी, थैंक यू।
थैंक यू।
बहुत बढ़िया।
पर्सनल सॉन्ग है।
Yes, और आपने गाया भी बहुत अच्छे से।
थैंक यू सो मच।
And now it is the time of vote of thanks. And for this, I would like to invite Sujata Lohani of IWC Hazaribagh. Over to Sujata.
सुजाता जी अपना वीडियो ऑन कीजिए प्लीज।
ये करेंगी भारती सहाय करेंगी, सुजाता ऑन द वे है, वो नहीं कर पाएंगी।
ओके
तो
ओके,
भारती सहाय तो अभी दिख रही थी, वो
हाँ
करेंगी।
हाँ हाँ, उनको
है?
मैं कर रही हूँ कर रही हूँ।
स्पॉटलाइट पे लिया जाए।
भारती जी अनम्यूट कर लीजिए अपने तरफ से।
हाँ, मेरी आवाज जा रही है?
हाँ,
यस
आ रही है।
जी, आ रही है भारती जी।
मैं भारती सहाय IWC हजारीबाग की पास्ट प्रेसिडेंट। आज का ये प्रोग्राम बहुत ही अच्छा था और मैं सर्वप्रथम हमारी जो चीफ गेस्ट सरिता दी को बहुत ही धन्यवाद देना चाहती हूँ, जो अपना बहुमूल्य समय निकाल कर आई और अपना वो समय दी, और सबसे अच्छी उनकी वो कविता लगी जिसे उन्होंने आज हम लोगों को सुनाया। और मैं डॉक्टर कविता प्रिया का भी बहुत बहुत धन्यवाद देती हूँ, जिन्होंने आज हम लोग को कैंसर अवेयरनेस के लिए बहुत अच्छी अच्छी जानकारियां दी, और हम खुद भी उस चीज को संभल सकते हैं और जांच कर सकते हैं। इसके लिए उनका बहुत बहुत धन्यवाद। मैं यहाँ उपस्थित प्रेसिडेंट धनबाद की प्रेसिडेंट निशी सिंह, बिहार शरीफ प्रेसिडेंट मंजू प्रकाश, हजारीबाग की प्रेसिडेंट सुजाता लोहानी, IWC जमशेदपुर वेस्ट की प्रेसिडेंट उर्वशी वर्मा, IWC पाटलिपुत्रा अंजुना की प्रेसिडेंट मंजू ढिंगरा, IWC राजगीर प्रेसिडेंट अंशु सांडिल्या, IWC स्वर्ण रेखा रांची की प्रेसिडेंट नीता नारायण। सबका बहुत बहुत धन्यवाद। मैं रिंकू बनर्जी, जिन्होंने अभी एक बहुत ही सुंदर गाना हम लोगों के सामने प्रस्तुत किया, उनका भी बहुत बहुत धन्यवाद, जो अपने बहुत ही सुंदर सुर से हम लोगों का वो गाना सुनाई। और यहाँ उपस्थित और क्लब की प्रेसिडेंट, CGR एंड मेंबर्स, मैं सबका धन्यवाद देती हूँ। और मैं सबको तो सब लोग इनको नहीं भूल सकता, निभा मिश्रा को, जो इस कार्यक्रम को करवाती हैं। उनको बहुत बहुत धन्यवाद।
सही बात है। हमारे आज के जो भी है सरिता